Hello. So I have major depressive disorder, generalized anxiety disorder, and an attentive ADHD. I have been on 12.5 milligrams of the stimulant medication Mydayis and 10 milligrams of the antidepressant Trintellix for about 3 months now. And in the last video, I talked about how I took a medication vacation, which wasn't on purpose. I kept waking up too late to take my stimulant medication. And if you have been taking stimulants, you know that if you take it too late during the day, especially the longer lasting stimulants, they'll keep you up at night. So because I was going to sleep really late and consequently waking up almost around noon, I just kept missing my medication. And then when I started back up on it a couple days ago, it gave me like a boost of energy and I was able to clean my room and get all this other stuff done. But yeah, today I want to talk a little bit about um, having the mental energy to do things. And I don't know if this is just an ADHD thing or a neurodivergent thing in general. But I think we're all aware that if you have ADHD, it's said that we have lowered levels of dopamine than people who don't have ADHD, and that's a big part of the problem. And I never really understood what was meant by things like, oh, there's a chemical imbalance in your brain until I started taking psychology classes and um, speech and language disorder classes for my communication and disorders major, which is what I'll be going into my master's for in August to become a speech therapist. Um, and even for speech and language disorders, dopamine plays a huge part. We learned about speech and language disorders from birth all the way to geriatrics. And for older people, there are disorders like Parkinson's and Alzheimer's, which also are often accompanied by speech and language disorders. And I think it's Parkinson's um, that is also accompanied by something known as dysarthria. And dysarthria is basically that we don't have the strength. It's like muscle weakness, so we don't have the strength to coordinate the speech and language muscles in a way that we can make the sounds and form the words that we need to in order to speak. And there are different types of dysarthria which are caused by different variety of factors. And I think it's Parkinson's disease that often is accompanied by something known as hypokinetic dysarthria, which is caused often by a lack of dopamine. And I remember this because this was a question on a test. So the professor talked about how people with this type of dysarthria don't have the right amount of dopamine levels in order for them to make the right movements that they need for speech. And a lot of them have a very breathy voice, very slurred, kind of slow speech, very low speech, so they don't, very quiet kind of speech. They don't speak loud enough or fast enough, and it's difficult for them to be understood. And that she was talking about how the low dopamine levels will also cause slow movements, not just for speech, but in general. They walk very slowly, they reach for things very slowly, because dopamine literally affects everything that we do. Having the right levels of dopamine is part of what enables me to be able to lift my arm, turn my head, to talk. It plays a part in pretty much anything. And so it makes sense that lower dopamine levels will lead to a lack of energy and a lack of motivation to do certain things that are boring and not exciting, and things that we're just not looking forward to. And I think that's part of the reason why uh, people with ADHD, why we procrastinate so much when it comes to even doing the simplest things. Like, for example, I have a cousin who I'm very close to because we grew up together. And about a week ago, she messaged me telling me that her brother, so my other cousin, her brother's birthday is coming up in August, and she wanted to see if I can make a custom hoodie for her. And I haven't even gathered up the energy to be able to respond to her, to the design that she sent me, and to be able to tell her whether or not I can make it for her, which again shouldn't take more than 5 minutes, but for some reason it's just sitting there in my Facebook Messenger and I haven't responded. Same thing with this order of invitations that I have to complete before the end of the month. The hardest part is done. So I already created the design. She already approved it. All I have to do now is look for the file because I don't even remember where in my computer I saved it, and print and cut the invitations, which is not really that difficult. But again, I haven't had the mental energy to be able to do any of that. Um, and I think that that's why we work so well in a panic, because dopamine kind of kickstarts your system, right? So it gets you started on tasks that you're supposed to do. And for someone with low dopamine levels, um, I worked in a panic most of my life when it came to school or most things, because I wouldn't study or do projects or do essays until the last minute, because I think that my dopamine levels rose whenever I was in a panic, because all of that excitement, even if it was mostly fear, uh, was flowing through my body. And that was enough to kickstart my system and kind of get me started on the task at hand, which was going to be due in like an hour, right? So I'm sure I'm not the only one who has worked in a panic induced state for most of my life. If you have ADHD, you probably know what that's like. So I'm not an expert. I'm not a doctor. I am going to school for speech and language pathology. I have my bachelor's degree, which I got back in May. So this isn't medical advice. This is just mostly speculation and me kind of talking about what I've learned about how dopamine affects the system and how that might be tied into why we procrastinate so much, because we don't have the dopamine levels necessary to jumpstart or kickstart our system to get started. And how do we get around this? Well, that's something that I'm still working on, but based on research and forums that I've read and even Facebook groups, uh, I've heard people say that, like, if they do 5 to 10 minutes of exercise before they have to start a boring task, then that kind of adrenaline will help them to get started. Like, they'll do like 10 minutes on a treadmill or something, and they'll get off and they'll start on their project or on the cleaning or whatever it is. I've had other people I've heard other people say that even eating like a piece of chocolate or something sweet before getting started will kind of give them that boost that they need to get started on a boring task. Um, so I guess there's a variety of different things that we could try, right? The stimulant medication has been helping. So like it was easier for me to clean my room the other day, but with smaller, more boring tasks like replying to messages, I still struggle. So that's something I'm still trying to figure out. And yeah, that's all I really wanted to talk about. So that's it for now, and I will be back.